Hi, I'm Father Michael Orsi. I am your host for Action for Life Television, that good news program which brings you the big G for the gospel of Jesus Christ and the little g, all the good things that people do to put that gospel of life into action. Hey gang, we got some dynamite program for you today because this is like a huge issue in our community. You know, we are all concerned, certainly this program, we're concerned about human life and how important it is to protect life and to nurture life. And if I talk to you today about, hey, I want to talk to you about people with cancer and what we have to do to help cancer patients, you say, yeah, Father, you got to do something about that, make sure the hospitals are equipped the best they can be, they have the best treatments, the best doctors. Yeah, we need some good places in our county here, Lee and Collier and all these places, and say, yeah, we need facilities for cancer patients. We need good doctors, oncologists to take care of them, good medication. All right, that's a physical ailment. Folks, sometimes it comes to a different story when we're talking about mental illness. And we say, I don't know that much about that. And, I agree that it's important to take care of these people, but, I really don't want to be around them. I'm telling you. When I was first ordained, guess what, folks? My first assignment was at the State Mental Hospital in New Jersey. How about that? And certainly, care for the mentally ill has changed a great deal from over 40 years ago. We have a need in Collier County to take care of people who are mentally ill. All kinds of mental illness, even with drugs and alcohol. It's my belief that people hooked on drugs and alcohol have a mental illness. It affects the brain. Today, I brought in an expert to talk about mental illness and how we treat it, and what we're going to do in Collier County to make sure that we have the best mental health facility in the whole world. The gentleman here is Scott Burgess, and he is the CEO of the David Lawrence Center. Scott, welcome.
Thank you for having me. Thank you. It's a pleasure to be here and an honor to be with you.
Oh, thank you so much. Okay. Tell us about the David Lawrence. What is this David Lawrence Center?
So the David Lawrence Center has been operating in Collier County for 55 years. We're celebrating our 55-year anniversary.
You weren't there all that time.
I wasn't there the whole time. I've only been at DLC for 9 years, but this is my 32nd year in community mental health. I worked for my previous organization for 22 years and did pretty much the same thing with helping advance the mission for helping those that struggle with mental health issues and or substance use disorders. So David Lawrence Center started out 55 years ago, and as you were talking about that state hospital back in New Jersey, there were those state hospitals everywhere across the country, and our founder, actually, Polly Keller, actually grew up living on one of those state hospital campuses because her father was the chief psychiatrist of that hospital system, and in those days, not only did the clients live there, but staff members and their families lived there as well. And she grew up her whole life understanding that individuals that had mental health problems were just like anybody else. They just needed to have the proper attention and treatment, and they could thrive and do well. Well, Polly was here in Collier County when she heard about this new mental health act that was put in place by John F. Kennedy in 1963 called the Community Mental Health Center Act. And the idea was to take all those people out of the large state hospital systems and put them back into their communities, surrounded by their loved ones, where they could be provided support and treatment right in their own communities, surrounded by their loved ones. Polly loved that idea, and she said, we need to have one of those here in Collier County. So she got a few of her friends together, and she said, let's try to raise some money and build a Collier County mental health clinic. And they started that 55 years ago, and Polly still volunteers with us today.
Really?
She is amazing. I can't keep up with Polly today. I can't imagine what she was like 55 years ago. Yep, she's right here still in town and volunteering and supporting DLC today.
Wonderful. So now could you tell us, How does the David Lawrence Center operate? How does it operate?
So David Lawrence Center, we have multiple locations, 6 different locations in Collier County. One of the locations, which is our largest location, is our Golden Gate campus, and that's right off of Golden Gate Parkway and really close to I-75. And that's where we provide all of our inpatient supports. So one of the things I like to talk about with DLC is to let people know that we're a 24/7, 365 operation. We never close. We're always open. And we provide services. We basically act in a crisis type of situation as the behavioral health emergency room for Collier County.
Okay, explain that. What does it mean?
So people, if they're going through a psychiatric crisis, whether that be severe depression, danger to self, maybe suicidal thinking, maybe there's thoughts of harm to others, or other types of severe psychiatric issue, they can come right to David Lawrence Center voluntarily by themselves, or they can be brought by paramedics, they can be brought by deputies that might be out there evaluating somebody, and they'll bring them directly to DLC. So people will come to David Lawrence Center, not necessarily go to one of the hospitals. In other parts of the country, usually people will go to the hospital first, and maybe that's where the behavioral health is taken care of. In Collier County, it's David Lawrence Center.
Yeah,
we provide that.
Folks, old Father O is talking from experience here, because there is no more hospital that does psychiatric help here in the county. So you can't say, well, ship them off to NCH or Physicians Regional. There ain't nothing there for them anymore. So we are dependent on the David Lawrence Center, and they have been working along with other organizations here in Collier County. We'll talk a little bit more about that later. But, people hear this term. Folks, you know this term. He's been Baker Acted. Could you explain that?
Sure. The Baker Act is a civil situation whereby a person has to meet a very strict criteria to force an involuntary hospitalization. So the actual statutes say that a person has to be an imminent threat, meaning right now, to self or others, or are completely unable to take care of themselves. In those circumstances, a person might be going through a very severe depressive episode, and they will come to David Lawrence Center, again, either voluntarily, they're being brought, themselves by, they could bring themselves, or a family member could bring them, or maybe they're being brought to us by one of the deputies, and our doctors have to evaluate the individual based on that very specific criteria, and if they are determined to be a danger to self or others, and they really need to have that inpatient stay, we will fill out a form, which is a Baker Act form. That's what it's called in Florida. And that will allow us to be able to evaluate that individual for up to 72 hours, at which point we have to either discharge them and let them go, or we have to go through a formal court proceeding in order to be able to keep them longer. And we actually hold court right at David Lawrence Center. Wow. So the magistrate comes and the court reporter, and we actually have a courtroom that's set up there. The doctor is able to be there to testify to the judge. The client, the individual, is able to testify on their own behalf. We could have family members that are there, and all that information is taken into account as to whether or not that Baker Act can be extended for a period of time, or sometimes the individual's saying that they want to be released, and the judge allows them because they say that they don't fit that exact criteria any longer.
Okay, so let's just talk about somebody comes to the David Lawrence Center, all right? Parents bring them. Yep. A kid on drugs.
Sure.
What do you do? You have somebody sitting there and say, oh, okay, fill out the form and see the doctor or the staff psychologist. How does it work?
Yeah. So if a person's in crisis, we have an emergency assessment center, which acts as that emergency department I was describing before. So that's one way people could come in. And then we also have what we call our general access center. And that's for an individual who might not have a crisis going on, but they're recognizing that they're struggling. They're recognizing that they need help and support. That's where some of our other services come into play. We offer outpatient therapy, counseling, outpatient doctor visits. We even offer in-home supports for children and for families to help support kids that are really struggling, or maybe adults that have very serious, persistent mental illness. They're not a danger. They are not struggling so much that they need to be in an inpatient setting, but they need a lot of support in the outpatient setting to live and thrive in the community. So we'll provide support right in the home. Some individuals that are adults that have very serious mental illness, we'll go to their house 2 or 3 times a day to make sure that they're taking their medicine.
Folks, do you hear this?
Yeah.
You know, do you hear all that the David Lawrence Center is doing and how important it is to our community? The services that they extend to people are just extraordinary. You have social workers,
Yeah.
you have psychologists,
Yeah.
you have psychiatrists,
Yes.
and you have medical doctors.
Yep.
And you can prescribe for these people.
Correct. Yep.
Okay? And, you know, do these people then know that they have to report back? Or how do you keep in touch with these people? Somebody comes in and says, you know, I got a pill and I feel better this week. We know how it is often with mental illness. You know, I feel good and I'm going to stop taking the medicine.
Right.
What
yes.
do you do?
Yeah. Well, in total, we have 380 staff members. Last year, we provided 318,000 services to Collier residents. So we're very, very active with a lot of staff members that provide a lot of different types of support. And when you're talking about medicine, our doctors, our psychiatrists, advanced practice nurses are also able to prescribe medicine. Situations are very common in which people will start with us, seeing the doctor maybe on a monthly basis. And then as they're doing better and better, they might see the doctor every other month, and then sometimes even once every 3 months. It's all based on how the person is doing and how their individual
follow-ups.
These are follow-up visits where they're going to come and visit with the doctor. They always start with an initial psychiatric evaluation. That's about an hour evaluation with the doctor that will review all sorts of history, will review what's going on now, what are some of the symptoms that they have. They may have been on medicine in the past that they had some side effects with or some problems with. They'll take all of that into account, and then they will prescribe medicine based on their experience. And as soon as that individual starts with the medicine, the doctor will usually have more routine visits with them until the client and the doctor feel that they're ready to step down those appointments, but they still continue to come for follow-up. And there are situations in which people will eventually kind of graduate off medicine.
Let me ask you about those who are addicted to drugs and alcohol.
Sure.
Certainly, you have a lot of them. Yeah. You know, Father O knows this. Why? Involved with St. Matthew's House, you know, work hand in glove with the David Lawrence Center. Also, you know, I've been involved for a long time with high school work, high school kids. And folks, you know, these kids get their hands on drugs, and sometimes it does things to their brains. And we have to rely on the David Lawrence Center. So can you tell us, what do you do with the addict that comes in, or the person that is an alcoholic? How do you do this?
Yeah, so it's all going to start with that first evaluation. We're going to determine, and again, if it's a crisis situation, they can go to our crisis center, and we'll provide that support in real time and immediately get them the support they need. Or they go through our general access department, and we'll still do that evaluation very quickly, but we'll link them into non-acute or non-inpatient types of supports. For an individual like what you're describing, individual that maybe struggles with serious alcohol problems, alcoholism, well, there's a likelihood because of the use pattern that they're going to need to have a detox program. Because if you try to immediately detox yourself off of alcohol and you don't do that in a safe manner, people can have seizures, people can actually die. So we have a detox program where somebody would check in. Typically, an individual is in our detox program for 3 to 5 days, and they're under a medical protocol as to how we're assisting them in being weaned off of whatever that substance was.
Is it cold turkey?
It's cold turkey, but we can prescribe some medicines that can help with that. And we're going to really medically supervise them to make sure that any complications that their body might be reacting to because of that use that they've had before, we're going to be able to attend to that. So, but there are some medicines that can help support the withdrawal effects of not being on the substance that they were using before. And then what we hope to do is within those 3 to 5 days to encourage the individual to take the next step, because we know recovery doesn't happen in 3 to 5 days. And you know that well with St. Matthew's and the involvement there. We do have a 28-day program, which we call Crossroads, which is also on our campus. So we encourage people to step down from detox into that 28-day program. They basically reside with us for 28 days. We're providing them all sorts of support. Group therapy, individual therapy. We have a doctor that will evaluates. Oftentimes there are people that have underlying mental health challenges.
Well, thanks, folks. Yeah, I'm glad Scott's bringing this up. Oftentimes, as I said earlier, mental health and addiction, they go together. Oftentimes, and you got to wonder, why did the person begin on this path toward drugs or alcohol? It can be because simply they're tormented, mentally tormented, and they feel, well, this drug or this alcohol will dull the pain, or whatever the pain may be. And that's why, see, David Lawrence Center is kind of one of these places where they work hand in hand with St. Matthew's House. Drug and alcohol addiction. In our program at St. Matthew's House, many people come in through the David Lawrence Center.
Yeah, sure.
Or we send them to the David Lawrence Center.
Yeah.
And we work together because addiction is something that needs a multifaceted approach. And I've seen miracles take place at St. Matthew's House. Somebody might be sent over to us from the David Lawrence Center after they've gone there cold turkey, and they're ready then to begin a program to get their lives back together again. And I suppose even while people are at St. Matthew's House, they can come back and get the special help they need.
Yeah, and we have St. Matthew's House van almost daily over to DLC because there are individuals that are in St. Matthew's House for longer term aftercare programs like at Justin's home.
Right.
And what we can do is provide the mental health support that some of them continue to need, whether they're also struggling with depression and they might need to have some medicine to help them with that. They can come back and we can provide that level of support
and
to them.
what about with the jails? How are you working out with the jails?
Yeah,
this is a big one. This is a big one.
We have a really wonderful relationship with the Collier County Sheriff's Office, and we're blessed in this community to have Sheriff Rambosk.
These guys are top notch. Let me tell you, folks, I know these police officers. I know the sheriff. I know the undersheriff, Jim Bloom. These guys are fantastic. They're friends of mine. Give them the respect and support that they need. Gabish, that's Italian. Okay.
Well, in Collier County, they've really done an amazing job, and I was very impressed with what had already been established before I got here, and we've only been able to build on that in the last 9 years through the relationship that we have with the Sheriff's Office. But we try very hard in Collier County to ensure that if somebody has a mental health problem or a substance use disorder problem, that we're directing them into treatment that's going to be helpful versus jail and law enforcement.
As you can imagine, producing this wonderful program, Action for Life, it costs a great deal of money. We're going to need your help. So if you would like to donate to keep this good news program on the air, please go to your computer, your cell phone, actionforlife.net. Hey gang, I know a lot of you sometimes can't watch all of our episodes of Action for Life. However, we have a solution for that. All you have to do is go to YouTube and search for Action for Life Florida. And you can catch up on all the shows, and guess what? Extra added bonus, you get to hear my weekly homily. So, YouTube and you make a fine couple.
All across the country, we have jails that are completely filled with people that have mental health problems, severe mental illness, severe addiction problems, and there's not an awful lot that's been going on to try to avert that. In Collier County, the sheriff made a commitment, and actually today was one of the days where training was being provided to sheriff's deputies at David Lawrence Center on how to identify mental health, how to identify a substance use disorder. What can we do to get those individuals into our detox program or our Crossroads program or one of our mental health programs versus them going to jail and not having treatment and not receiving the support that they need. Now, obviously, if there's a clear-cut criminal behavior that they need to be in jail, they're going to do that. But whenever there's a possibility and an opportunity for us to try to provide treatment first, that's the route that we go. And what we've been able to see is that the support through David Lawrence Center and the services we're providing, the trend line just goes up exponentially across time, and the jail census goes down. And guess what? The safety of this community has only been enhanced. We're one of the safest communities in the nation.
I think we're listed #1 city in the country.
Yes.
And that's because we're a safe place. And, oftentimes in the big cities, you'll find that there are people who are living on the streets. They have mental problems. The place becomes unsafe. It's not the case here in Naples. Not the case. And as I said, I've been in the hospital too many times. And oftentimes I see the sheriff's department bringing in somebody because of criminal behavior, because of mental illness. They've been Baker acted. These guys are pros. They know how to do it. And they tell me, we just came from David Lawrence. We're going back to David Lawrence. Okay, yeah. So it's a good working relationship to help people live good lives, to help cure them of, or at least to manage their mental health. Yeah. Now, I want to ask you a question. Who pays for all of this? Yeah.
Well, we have a blended funding stream. Mm-hmm. So we do receive some state support, which is wonderful through state grants. However, the state of Florida, when you look at it just from a direct data standpoint, is one of the lowest funded for mental health and addiction services in the country. So we've got room to improve there.
Somebody told me 49th out of 50 states.
49th out of 50, yes.
I mean, I don't like this. Governor, I'm telling you right now, you got to do something about it. Get us up there. It's got to be. We can't be next to the bottom. Which is the bottom?
You know what? Off the top of my head, I can't remember.
All right. We don't want to be there. Okay.
Yeah, right, exactly. So we do receive some state funding. Collier County provides a little bit of funding as well. And we are able to bill if individuals have insurance, and that might even include Medicaid or Medicare. So all of those things are helpful in providing some support. And then we have to go for grants that we apply for through private or public foundations. And then about 10% of our budget is philanthropy. These are donors in the community that say, this is really important to me. I know how important it is to the community, for individuals, for families, and for our community. They want to support us.
Somebody comes in, I don't have any insurance. I don't have good insurance, whatever the case may be. You prorate what they can pay. You say, well, you can give us $10 a month. I mean, how does it work?
Yeah, so we don't turn anybody away. We have what's called a sliding scale for services, which will slide all the way down based on a person's income. So if a person has very low income, they might just pay $3 to see the doctor.
Or that's a deal. Such a deal.
That's a pretty good deal. Yeah. So and we won't turn anybody away. About 60% of the folks that come to DLC don't have any insurance at all. Okay. So we want to be, we have been historically for those 55 years, and we plan to be that all the way in perpetuity, available to anybody in need.
That's great. And, I want Scott to tell us about some really good news happened, just like 2 weeks ago. This is big, folks. Old Father O was there when this was proposed to the county commissioners. And there's going to be a big expansion at the David Lawrence Center. So tell us all about this. Is wonderful. I was so happy. I can't tell you how happy I was.
Well, thank you. And thank you for being there, and thank you for all your support in this process. I guess it starts back with about 5 years ago. One of the things that I had worked on with then Commissioner Solis and a whole group of key stakeholders was a strategic plan for Collier County related to mental health and addiction services. Prior to that, there had not been kind of a formal county plan on how to effectively deal with these issues. So through that process, which was a lengthy process of a couple of years, and we brought in experts from around the country to help us with this as well, what we identified was the number one priority was to build a bigger facility that could help us take care of more people right in Collier County through David Lawrence Center services. And when we looked at all of the data, we are actually still having to send hundreds of Collier residents out of Collier County for these services because DLC simply doesn't have the bed capacity. And as you mentioned, the hospitals don't have that capacity either. So in our area, David Lawrence Center is the behavioral health provider. So we recognized that that needed to be the number one priority. So we started working on plans. What would that look like? Well, we were very blessed that here in Collier County, the 1 cent sales tax initiative went into place, and it identified 4 key community priorities, of which one of them was this new building. So the Collier taxpayers actually voted to tax themselves.
Folks, you see, you know when something's important, you know when it's the right thing to do, and it was like the 1 penny tax deal, whatever. So then, anyway, because we're running out of time, but I could go on forever with this beautiful story. The commissioners then voted for what?
They voted to build this facility, which is going to be a 55,000 square foot facility. The first phase, it'll have 87 beds. Currently, we have 45 beds, so 87 beds in phase 1. Phase 2 will allow it to go to 102 beds.
It's important. Why? The county is growing. Right? The county is growing, and we need a place to help people who have a problem. I saw the plans, folks. I saw the plans. This is going to be a beautiful state-of-the-art facility. So tell us now where we are with that. How long is it going to take us?
So we think it's probably going to take about 2.5 more years, unfortunately, because we still got design work to do. They've got to do the civil work, and then we have to build. And things have been a little bit tricky with building lately.
Well, we know that.
So we're thinking about 2.5 years. In the meantime, at David Lawrence Center, we're trying to expand, where we can a little bit on our current campus to see if we can get more beds.
Fantastic.
To help.
Fantastic, folks. Go on, as I said, this is a great story. It's an important thing for our county. I want to thank the commissioners who supported this at the commissioners meeting we had just a couple of weeks ago. Folks, this is such an important thing for our community. I'm so happy to have Scott Burgess here today. And I hope that, when they have their fundraisers and they have all of those things that help keep the David Lawrence Center going, that you'll contribute to this. It's a worthy cause. Hey, I'm for action. Scott's for action, and I know you are too. We would like to thank our generous sponsors for their wonderful support. Thanks for watching. Please join us next time for Action for Life. I'm for action, and I hope you are too. I'm Father Michael Orsi. I am your host for Action for Life Television, that good news program which talks about the gospel of Jesus Christ, the big G, and the little g, all the good things that people are doing to put the gospel of life into action. So please join us for the next episode of Action for Life.